breaking news, folks. There was an first eyewitness of the shooting of the CEO of United Healthcare. You've got to see this.
United Healthcare assassination comes forward. We take you live on the scene.
Yes, I saw the guy who shot that poor man. I even saw his face before he pulled up his mask. In fact, he dropped his ID on his way out. Wait, it was the CEO of United Healthcare who got shot? The same corporation that stopped covering my insulin? The same corporation that denied my Meemaw breast cancer treatment, resulting in her early death? Oh yeah, I ain't see shit. Someone got shot. What ID? Oh, this mine. You don't need to see it. In fact, get this camera out of my face.
Hey everybody, welcome back to Starkey Farmstead. So this video is going to go deep. We're going to talk about how half of our country is cheering the death of CEO Brian of United Healthcare. And then we're going to talk about why. Why are people willing to overlook the death of a human? And I feel like maybe it comes from the fact that this company in 2021 denied 50 million people treatment. Hear me say that to you again. 50 million Americans were denied treatment from United Healthcare in 2021 alone. People are tired of it. Now, we have to come from a biblical standpoint, right? A lot of us, our flesh says yes, but our spirits say no. Because God said that murder was a sin, folks. And he said that literally, let me have my vengeance. And it goes so much further than that, because there's actually a photo, this one right here, where you can see the supposedly the shooter's face. And then you see this picture. Now, the one with the face covered is the actual shooter. There's not that much alike in these two photos, including the jacket. Look carefully at the jacket. So is the guy that has his face exposed, is he the new patsy? Because I'm hearing rumors that Brian was supposed to actually go in front of Congress and throw Pelosi underneath the bandwagon. He was a whistleblower. So my husband and I were talking about this earlier, and I said, there's only two reasons this man was shot. Either he denied the shooter's family member health care, or he was a whistleblower. And it looks like he may have been fixing to be a whistleblower against Pelosi. Oh, the plot thickens, you guys. It looks like Brian was going to go before Congress and discuss Nancy Pelosi's insider trading at the same time that United Healthcare had a cyber attack. Look how much money this woman made. Anybody want to, make $11.4 million before taxes in one decision on the stock market? Come on, you guys. This guy was assassinated, and they made it look like some crazy person who had a beef, because they even went back and used, based off a book someone had written, deny, defend. Look, that's what was written on the bullet. So they put all this together. Why do you think the police officers can't find him? The plot thickens every which way we look. Because the truth is, I found some videos that were done a year ago on United Healthcare. And I was so blown away at their history about who they truly are as a company, the way that they twisted the American healthcare system. And United is the worst. When you look at how much money these people have made, United Healthcare is the top in just busting people down and refusing to give them care. They actually have a name for it. It's called denial nurses. So they hire registered nurses to sit behind a desk and deny people like you and I health care. And so many people are actually celebrating this man's death because the shooter put on the bullet, deny. I don't know. You guys tell me what you think in comments. I mean, I know I started the video off probably a little off foot for some of you. But the point is that this is how people feel. They're having look-alike contests in New York where when people win, the contest, half of the money that they win goes to whatever charity they're choosing. They said this is going to be an annual thing. It makes you think. So right now we're going to bust out, how did United Healthcare become the #1 scammer in the healthcare system of the United States? How did they get the control they have? Are you guys ready? Because here we go.
The vital care that they need. And it goes far beyond just our already broken system. So, who's the shadowy supervillain behind this plot to rip off both doctors and patients? It's America's largest insurer. This is The Classroom for More Perfect Union, and today we're looking at the massive power of United Healthcare. Before we get into United Healthcare's new strategy to shortchange doctors and patients alike, we need to talk about how they became America's largest insurer. United was founded in Minneapolis in 1977 and pioneered a new kind of insurance, treating people within closed networks of providers, health maintenance organizations, or HMOs. HMOs were pitched as a way to curb America's exploding healthcare costs, which did not happen. HMOs proliferated after 1973 as a result of the Health Maintenance Organization Act, which gave federal grants and mandated employers offer an HMO option to their employees. The law suddenly made HMOs very popular and very profitable. Alec told me about an old non-profit HMO, Physicians Health Plan.
It's a network of doctors in a health maintenance organization in Minneapolis, and they had hired United Healthcare to manage the HMO. Physicians Health Plan is a nonprofit, but United Healthcare is very much for-profit.
Were the doctors happy? Was this a good system for them?
No, they were so unhappy that there was national news coverage that they were threatening to unionize. They were mad that they were being underpaid by United Healthcare, saying it was barely enough to cover their overhead. They were also alleging a conflict of interest with the chair of the nonprofit Physicians Health Plan, who was Richard Burke.
And who ran the for-profit United Healthcare?
Also Richard Burke. So this man who was running a nonprofit had hired his for-profit company to manage this nonprofit tax-exempt organization.
When you first mentioned Richard Burke to me, I tried looking him up online, and there's really not that much. I tried a video search, and I only found this one video.
The whiteboard video?
The whiteboard video. This guy with a whiteboard that's literally about how it's so hard to find information about this guy online.
He's only mentioned once in United Health Group's own history. He's been thoroughly involved since the beginning, and he's thoroughly involved now. There are very few to no articles about this person. Can you find articles about the founders of all these companies? Gobs and gobs and gobs of them, but not Richard T. Burke. Organizations are not nameless and faceless. I mean, they are groups of people, and people are responsible for decisions that cause these organizations to be the way they are.
Much of United's initial growth was enabled by the HMO Act and the $300 million in grants from the government. Burke and United started snapping up all of these federally subsidized insurers, essentially stealing entire taxpayer-funded organizations. And it makes a lot of sense that the bill was so helpful to United Healthcare. It was written by a think tank, Interstudy.
Interstudy was founded by Paul Elwood Jr. He's this guy who's called the father of the HMO. But I also found another important figure at Interstudy. One of the directors was none other than Richard Burke.
Denial nurse.
Denial nurse.
It isn't just nurses poring over claims looking for excuses to deny them. Tech plays a role too. Dr. Alan Mooney, an executive at United, pioneered a system that allowed for bulk claim denials at rapid speed. United's aggressive denial or underpayment of claims has made them the target of tons of lawsuits.
They're losing a bunch of cases. They were sued by two healthcare groups, Team Healthcare and Envision. The things that they were alleging in these suits that they won was gross underpayment and mass denial of claims, right? So in the case of Envision, they were rejecting nearly half of all the doctors' claims for medical care.
Huge hospitals have very expensive, well-staffed billing departments to chase down insurers for money, but most small practices don't have that luxury.
Here, I asked a question and I said, how many of you want the killer to be found? Yes or no? Consistently, for the last 3 hours, every time I check the percentages, at least a minimum of 19% of voters said we want him to stay free. That's a lot of people, guys. I want you to think about that. Almost 20% of the voters on that poll felt like there was some validity behind the killing of this multi-billion-dollar company. But it goes so much deeper. So I'm curious, what do you think? Do you think this was someone whose family member or loved one died at the hands of a cold-hearted CEO, billionaire healthcare company? Or is it a much deeper assassination to keep a whistleblower's mouth shut? And I'm going to leave it up to you to decide which one you think it is. So like, comment, share this video, and drop your answer in comments.